Hi, my name is Shannon, and I'm a lupus fighter, and I've been in your shoes.
I'm Casey. I have lupus. I understand where you are, and I understand how hard it can be to try something new. My joints started locking up. I got a rash on my hands and on my face, and then I got like ulcers in my mouth and in my nose.
I really thought I had a bad case of like the flu. I was abnormally tired. I felt like someone poked a hole in my head and all the energy came out.
I was running fever all of the time. I was so fatigued. I was sleeping somewhere like 16 hours out of a 24-hour period.
My joints, particularly my hands and my knees, they would swell up and stay swollen for like 2 to 3 days.
I think my story, like a lot of people's, is filled with a lot of uncertainty, and there's a lot of question marks at the beginning that I didn't know how to figure out. Like, where do I get the answers to this? How do I learn how to do this? Being invited to provide feedback for this program makes me feel like our patient voices are being heard.
One of the top reasons I wanted to do it is because I know the feelings that you have once you start a new therapy. I wanted someone to look at me and see themselves in me and use this resource because I didn't have that opportunity when I was first diagnosed. I was just on the internet looking up things.
You know, our journeys are not going to look the same. They're not, but there is hope.
It may sound cliche, but you have lupus. Lupus does not have you. Don't let it be your end-all, be-all. Yes, it is a part of you, but it does not have to consume all of you. You got this.
Important safety information. Do not use SAPHNELO if you are allergic to anifrolumab-fnia or to any of the ingredients. Before you receive SAPHNELO, tell your healthcare provider about all of your medical conditions, including if you think you have an infection or have an infection that keeps coming back, are scheduled to receive a vaccination, or if you think you may need a vaccination. You should not receive live vaccines during treatment with SAPHNELO, have or have had cancer, are receiving other biologic medicines or monoclonal antibodies, are pregnant or plan to become pregnant. It is not known if SAPHNELO will harm your unborn baby. Tell your healthcare provider if you are, might be, or plan to become pregnant during treatment with SAPHNELO. A pregnancy exposure registry monitors pregnancy outcomes in women exposed to SAPHNELO. You can find out more information about the registry by calling AstraZeneca at 1-877-693-9268. Are breastfeeding or plan to breastfeed. It is not known if SAPHNELO passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. SAPHNELO may affect the way other medicines work, and other medicines may affect how SAPHNELO works. SAPHNELO may cause serious side effects, including serious infections. SAPHNELO can lower the ability of your immune system to fight infections. You may be at a higher risk of developing respiratory infections and shingles, herpes zoster during treatment with SAPHNELO. Infections could be serious, leading to hospitalization or death. Allergic hypersensitivity reactions, including anaphylaxis. Serious allergic reactions can happen during or after you get your SAPHNELO infusion. Tell your healthcare provider or get emergency help right away if you have any of the following symptoms of a serious allergic reaction: swelling of your face, mouth, and tongue, breathing problems, fainting, dizziness, feeling lightheaded, low blood pressure, cancer. SAPHNELO may reduce the activity of your immune system. Medicines that affect the immune system may increase your risk of certain cancers. The most common side effects of SAPHNELO include upper respiratory infections, bronchitis, infusion reactions, shingles, herpes zoster, cough. Infusion reactions can happen at the time of the infusion or shortly after. Symptoms may include headache, nausea, vomiting, feeling tired or weak, fatigue, and dizziness. These are not all of the possible side effects of SAPHNELO. Call your healthcare provider for medical advice about side effects. What is SAPHNELO? SAPHNELO is a prescription medicine used to treat adults with moderate to severe systemic lupus erythematosus, SLE or lupus, who are receiving other lupus medicines. It is not known if SAPHNELO is effective in patients with severe active lupus nephritis or severe active central nervous system lupus. It is not known if SAPHNELO is safe and effective in patients under 18 years of age. Please see full prescribing information, including patient information, at www.saphnelo.com/PI.